Companion Therapeutics, managing the negative consequences of your medicines. Companion Therapeutics' portfolio consists of 8 different products, 3 of which are patent pending. All of them have a unique and specific objective: to maintain the nutritional balance affected by the prolonged use of medications, since the breaking of this nutritional balance is the main cause of the adverse effects of such medications. Long-term medications very often interfere with the absorption, synthesis, or metabolism of multiple components in the organism, and the chronic exposition to this interference finally leads to nutritional imbalances. Then, over time, these nutritional imbalances are going to produce undesirable side effects. If patients take action at nutritional level by supplementing a suitable form of nutrients along the whole treatment, they will be able to avoid the nutritional imbalance arises, and if the nutritional imbalance is blocked, the side effect will be blocked as well. As an example of one of the products, the first group of medicines we approached to were the proton pump inhibitors or PPIs. They were selected for 2 main reasons. Because PPIs are one of the most sold therapeutic groups in the US, with near 7 billion doses sold in 2015 according to IMS data, and because their main adverse effects are mediated through a series of nutritional imbalances. Side effects of PPIs are caused specifically by its own mechanism of action. In normal conditions, the gastric pH is acid, with values around 1 to 1.2. When proton pump inhibitors are administered, the gastric pH can rise to values around 4 to 5 due to the blockage of the hydrochloric acid secretion. Since gastric acid plays an important role in several biochemical processes, its long-term inhibition can produce undesirable consequences. For example, gastric acid is a key player in the absorption of vitamins and minerals, such as calcium, magnesium, iron, and vitamin B12. The lack of gastric acid has clearly shown to affect the absorption of these 4 important nutrients, which can lead to severe adverse effects. Regarding the long-term use of PPIs and its relationship with these 4 nutrients, FDA warns, in case of calcium, there's an increased risk of osteoporotic fractures, especially of hip, wrist, and spine, caused by calcium malabsorption. In case of magnesium, cases of hypomagnesemia have been reported due to magnesium malabsorption. This hypomagnesemia can lead to several muscular problems. In case of iron, interference with the absorption, which can produce hematological problems. And in case of vitamin B12, risk of deficiency, leading to neurological problems. Other important role of the gastric acid is to control the microbial proliferation. The stomach is normally free of bacteria because of its acidity. Acid suppressive therapy may cause bacterial overgrowth, leading to infections in the stomach and along the gastrointestinal tract. One of the strengths of this product is the plentiful support, for example, clinical trials, systematic reviews and meta-analysis, and even FDA public alerts related to each of the mentioned nutritional imbalances and side effects caused by the regular use of PPIs. All this background has allowed Companion Therapeutics to create well-supported scientific communication assets, which have been presented to several healthcare professionals with great success. These communication assets are key in the strategy of collaborating with the healthcare professionals to create demand through their recommendations. Understanding the mechanism of how PPIs affect the balance of vitamins, minerals, and intestinal flora, Companion Therapeutics developed Proton Support. Proton Support helps in handling the main adverse effects associated with the long-term use of proton pump inhibitors by means of maintaining the balance of vitamins, minerals, and intestinal flora commonly affected by the chronic use of this type of medicines. But why Proton Support is different from the other dietary supplements available in the market? Let's take the calcium as an example. The lack of gastric acid or achlorhydria in regular consumers of proton pump inhibitors makes them unable to absorb this nutrient from either food or from common dietary supplements, and this is a proven fact. In a study conducted by the Wayne State University, the effect of proton pump inhibitors on calcium carbonate absorption was evaluated. The results shown a significant reduction of the calcium absorption from calcium carbonate in patients taking omeprazole compared to placebo. These results are highly relevant since calcium carbonate is the most commonly used salt of calcium in dietary supplements in the US. But why it happens? The answer is because of the solubility of the calcium salts. Most of the calcium salts decrease their solubility when pH increases, and the increase in gastric pH is exactly the effect of PPIs. So, at high pH, calcium salts are not dissolved and therefore they are not absorbed. How did Companion Therapeutics research team found a way to solve this problem? The answer is finding a calcium salt whose high solubility does not depend on gastric pH. The properties of the calcium salt selected by Companion Therapeutics makes it particularly beneficial for individuals with low or with no gastric acid. The result of this high solubility is that this calcium salt is almost double bioavailable compared to calcium carbonate. A similar strategy was applied to the rest of the components. Specific forms of vitamin B12, iron, and magnesium were selected to ensure their solubility and bioavailability even in the absence of hydrochloric acid. The product was complemented with vitamin D and vitamin K2 to help in the absorption and use of the calcium by the body, and with a proprietary blend of probiotics and prebiotics to maintain the balance of the intestinal flora affected by the prolonged use of PPIs. A patent application for this product was filed to the USPTO as well as the PCT. The patent application is intended to protect the blend of vitamins, minerals, probiotics, and prebiotics, which both theoretically and through clinical trials of individual components have shown to be more beneficial in patients with lack of gastric acid, as for example those who take PPIs on a regular basis. The process at the USPTO is on its final stage, so it's expected to be granted in the upcoming months. Companion Therapeutics. When it comes to chronic diseases, you will never be alone.